How should I prepare for brain surgery? Brain surgery requires careful planning. Your healthcare provider will perform a physical examination and blood tests. They want to make sure you're healthy enough for anesthesia and surgery. You may also have a range of imaging tests, such as MRIs, magnetic resonance imaging, CT, computed tomography, scans.PET scans, positron emission tomography, Angiography. These imaging tests create highly detailed pictures of the tissues, nerves, and blood vessels in your brain. The pictures help your surgeon locate the exact areas that need treatment. Before your surgeon will give you information about making adjustments to your health before surgery. If you smoke tobacco products, you should stop several weeks before surgery. Smoking increases the risk of surgical complications and can make it harder for you to heal. Stopping or starting certain medications before surgery. Some people take steroids before brain surgery to reduce the risk of swelling. Antibiotics reduce your risk of infection after surgery. Anti-epileptic drugs reduce the risk of seizures. If you take blood-thinning medication, you may need to stop this a few days or a week before surgery. What to expect during and after surgery. Your surgeon will give you information about the procedure, answer any questions you may have, and explain the possible side effects. Depending on the type of procedure you have, there may or may not be a lengthy recovery period. And you may need neurological rehabilitation. What happens during brain surgery? The brain surgery procedure varies based on the type of brain surgery you need. Your surgeon will explain what will happen during your surgery when you meet with them before the date of your procedure. You can expect the following during open brain surgery. An anesthesiologist will give you anesthesia. Your surgical team will shave your hair that's near the incision site. They'll clean the area after removing your hair. Your surgeon will make an incision, cut, into your skin. They'll cut and move tissue and muscles. Your surgeon will use a surgical drill to make holes in your skull bone. They'll use a surgical bone-cutting drill bit to cut in between the holes to remove a piece of your skull. Your surgeon will treat your brain. This could include removing a tumor, relieving pressure, or repairing blood vessels. Your surgeon will replace the removed portion of your skull and secure the bone in place with plates and screws. Then, they'll move muscles and tissue back into place. Your surgeon will close the incision in your skin. If you're undergoing endovascular surgery or a neuroendoscopy, your surgeon won't make an incision on your head and they won't need to open your skull. Instead, they'll use specialized tools and techniques to reach your brain through your nose, mouth, or blood vessels in your groin. Will I be awake for brain surgery? You may be awake for brain surgery. Some types of brain surgery require general anesthesia, which means you're completely unconscious and asleep. But other procedures only need sedation, meaning you're partially asleep, but can still respond to certain stimuli. During certain surgeries, you need to be awake. This is the case for some tumors, epilepsy, deep brain stimulation, or neurological conditions. When you're awake, you'll receive anesthetic on your head, so you don't feel pain from the incision. You'll also receive sedation to put you into a light sleep. Your surgeon and anesthesiologist will wake you up during the surgery and ask you to perform tasks. You may need to speak, move a body part, look at objects, or remember information. This process helps your surgeon avoid important areas of the brain during surgery. Where will a surgeon make an incision during brain surgery? The location of the incision, cut, during brain surgery depends on what your surgeon needs to treat. Sometimes brain surgery requires opening your skull to make an incision in your brain, but many procedures can access your brain through your nose or mouth. Minimally invasive brain surgery poses fewer risks than open brain surgery and helps you heal faster. How long does brain surgery take? Brain surgery can take anywhere from 2 to 6 hours or more, depending on the complexity of your surgery. What happens after brain surgery? After brain surgery, you'll stay in the hospital for observation. For less invasive procedures like endovascular surgery, you might only need to stay for 1 to 2 days. But after an open craniotomy, you might need to stay in the hospital for up to 10 days. You may be in intensive care after open brain surgery overnight, so your care team can monitor your vitals before you move to another area of the hospital to rest. While in recovery, you may feel tired, sore, or have a headache. Your care team will give you medications to help you feel comfortable. Your healthcare providers may recommend you continue taking medications they prescribe to you before your surgery to make sure you don't have complications. You can expect to get regular imaging tests of your brain after surgery. You'll also schedule times to meet with your care team within days, weeks, and months so they can continue to monitor your healing progress. Rehabilitation may be part of your recovery. This can help you restore certain functions that surgery may affect, like your strength, mobility, and ability to talk. Your care team may include physical therapists, speech-language pathologists, SLPs, and occupational therapists. Thanks for watching the video.